Hello viewers and learners of the MEV 002 course and module, that is Environmental and Occupational Hazards. I introduce myself as Dr. Sushmitha Baskar, working in the discipline of Environmental Studies at the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University, New Delhi. Now we will discuss about the management of the hazardous healthcare waste. So in this module, we will see how the hospital waste and the healthcare facility waste, we have already discussed the type of waste and how infectious or non-infectious these can be. How can we manage them by using the proper standard protocols and also the proper technologies for combating the same. That is what we will be discussing here. Now, after listening and learning this module, you will be able to describe the management of the hazardous healthcare waste and the processes that are involved in the same. According to the Ministry of Environment and Forest, almost 28% of the biomedical waste is left untreated, and this may not be disposed of scientifically. So, it is an alarming fact that only 2/3 of the total waste is treated scientifically, that may be through recycling, and the rest is getting mixed with the municipal waste. So, in our own homes also, if you see, it is not only from the healthcare facilities that we are having the hazardous waste. Due to certain other reasons, because of the high hospital expenditures, the elderly people, because of certain cardiac failure or the right heart failure, a certain other kidney failure and other problems, it may not be possible for the people to admit their wards or their kith and kin in the hospitals for months together or even years, because sometime a person can be bedridden even for 1 year or even 2 years. It can be a long process. So in that case, they have to be managed well at home. They have to be taken care at home properly. So we may be disposing a certain hazardous waste, for example the diapers that may contain infectious material, then the pads, the bed pad that you are using under the patient, that may also contain certain infectious fluid. For example, since they are lying down for many years, that may have certain bed sores. The bed sores may be certain infectious that can contain pus, that can contain blood. So it may be possible that we don't tie them separately in the proper colored disposable bags, but you just mix it up with your household or domestic waste, and then it gets ended up in the municipal waste. So that should not be done. So inadequate waste management can cause environmental pollution. It can cause unpleasant odors, growth and multiplication of bacterial organisms, microbes, insects, rodents, worms, and it can lead to the transmission of diseases like typhoid, cholera and several other infectious diseases. Globally, people lack the awareness. There is poor disposal mechanism and insufficient resources result in the unsatisfactory biomedical waste management in healthcare facilities, and especially in the developing countries, in the low and the middle income countries, we find this problem. India also, if we take an example, it is a developing country, and here again there is disparity. We have the poor are getting poorer, the rich are getting richer. So there is a disparity. So the poor people are not able to admit their wards, as I told you, due to high hospital expenditure. Even a day in the ICU that costs you more than 25,000 rupees, ventilators that costs you 15,000 rupees or even more. The actual amount may vary according to the time, the pandemic and so on. So it may not be possible, they will have to manage at home. Again, poor awareness, they may not be scientifically educated in that sense. So they don't know that the waste should not be mixed up with the normal waste. So poor waste management is a serious concern, and that is being identified by the government as well as a non-governmental organization. So here again, if you are disposing, then at that point, if the waste collection disposal system exists, then segregation becomes a very big problem, because they have to segregate each and every thing from those domestic waste also. Government intervention and the biomedical waste management regulation. So after 1998 in our country, in 2016 we had the new guidelines for handling the biomedical waste, and that was released by the Ministry of Environment, Forest and Climate Change. So there was categorization and authorization with a barcode system, and there was proper control that has been made, and that has now been made mandatory. They have also made provision for the pre-treatment of the blood sample and the lab waste. So we need to pre-treat the blood sample and the lab waste before we are releasing it out. Then the hospitals and the healthcare facilities, they should ensure effective disposal mechanisms directly or through common biomedical disposal and the treatment facilities. A proper biomedical waste management program, they should address the following factors. They need to identify all the departments that are generating the waste and the departments that are handling the waste. oversight of the waste management program by the infection control department. There should be mechanisms to identify and report the incidents of improper waste segregation like needle stick injuries. They should ensure that the treatment, transportation and disposing of the waste is also done effectively and scientifically. Training is very important. So, training in the policies and processes that are being done for the biomedical waste management, that is very crucial and important. Use of personal protective equipment is again an important factor. Handling emergency situation like waste spillage, following the color codes for proper segregation of waste, and that labeling also, it can indicate the nature of the waste. Improper transportation and storage of waste, storage area and bins should also be cleaned and disinfected properly. Now, it is a responsibility of the entire healthcare industry along with the hospital staff to ensure that the biomedical waste is managed efficiently. So, the new guidelines of 2016, this has to be implemented properly in every healthcare sector and facility so that the biomedical waste are minimized and they are eliminated completely. Segregation. This is an important element in efficient healthcare waste management. By separating the hazardous from the non-hazardous waste, one can reduce the volume of the waste that is requiring specialized treatment. Waste classification, waste minimization, containerization, color coding, there is a color coded bins are important, labeling, signage, handling, transport, storage, treatment and the final disposal. So, all this needs to be done in the proper way, following a flowchart kind of a system, and then we can say that the waste has been managed properly. There should be continuous training for the personnel who are involved in it. There should be planning provisions, budgeting, monitoring, evaluation and documentation, record keeping. All this is very important because they should know that when the waste was generated and whether it was pre-treated and what date that is going out and so on. So, documentation and record keeping is a very important factor also in the healthcare facility sectors. There are 4 main processes that are involved in the treatment of the healthcare waste. They include thermal, chemical, irradiative and the biological processes. Let us see them now one by one. Biomedical waste is any waste that is produced during diagnosis, treatment or immunization of the human or animal research activity pertaining thereto or in the production or testing of biological or in health camp. Though we have defined this earlier, but still before going on for the treatment, we should know the definition of a biomedical waste. Therefore, characterization, quantification, segregation, storage, transport and treatment of this waste is very important. The 3R principle is again an important thing. You need to reduce, recycle waste and also reuse the waste if possible, only where possible, because in biomedical it is not possible that you can reuse and recycle everything. Now, when we say even the recycle, okay, sometimes for non-infectious cases and non-infectious patients, the bed linen or the bed wrappings, the pillow covers that are being used or the blankets, they can be recycled, they can be washed, disinfected well and they can be recycled, they can be reused. But in case of infectious diseases, then they need to use a one-time material and that has to be disposed of. Then avoiding the generation of waste, that is one step. At the source, if you are reducing the amount of the waste that is generated, that is produced, then the next step becomes easier. Then if you can recover as much of waste as possible, again the steps become easier. Then there should be less waste disposal, and if at the source itself we can tackle the waste, then at the final point, at the end point, we do not have certain problems. So, treatment and disposal facility, this refers to any facility wherein treatment and disposal of the waste is carried out. The hazardous waste, now this can be physical, chemical and microbiological risk to the general public and population, to the healthcare workers who are associated with handling, treatment and the disposal of such waste. Now, in Geneva in 2007, I think it was in June or July 2007, the World Health Organization held a meeting and they had certain core principles for achieving safe and sustainable management of the healthcare waste, and that was developed. Here they stressed that through the right investment of the resources and commitment, the harmful effects of the healthcare waste to the people and the environment can be substantially reduced. The first edition of the WHO Handbook on the Safe Management of Waste from the Healthcare Activities, it was published in 1999 and this book was known as a Blue Book. The second edition of the same book, Blue Book, it came out in 2014, that is almost 10 to 13 years later, and that has novel methods, newer methods for the safe disposal of the biomedical waste, that has new environmental pollution control measures, and also new technologies, because some technology which was existent in the 1990s, in the 2014 we have new technologies and later detection techniques, advanced detection techniques also, which have been given in the book of this, which was published. Mainly the book focuses on the healthcare waste management in case of emergencies, in dealing with the emerging pandemics in emergencies, drug resistant bacteria, then climate changes, and also the global warming problems related to environment and health. In 1998, the first biomedical waste management rule were notified by the Government of India and by the then Ministry of Environment and Forest, because now it has changed to Ministry of Environment, Forest and Climate Change. In India, the scavengers sort out the waste in the open. Okay, you would have seen how the rag pickers do it. They collect it. You have this kabadi wala, he comes and they collect all the kuda and the waste from everywhere, all the sectors, and in a disorganized way and in an unorganized way, without using any glove or mask or shoes or any head gear equipment like caps, boot protections or the shoe covers. They just do it with their own hands. They start recycling and resorting that entire thing. They segregate it. So here again there is a problem of contamination, contaminating the environment, because they are throwing everything on the ground, on the soil, and some may remain over there. It could be even certain infectious syringes which is broken or contaminated. There again there are other problems of reuse of syringes without sterilization, because when you are sterilizing, you are heating it at high temperatures. It is supposed to kill the bacterial spores and certain bacterial or the microbial infections. In the 2000s, there was no proper biomedical management system in our country, if you take the year in 2000 and even before that. And researchers have reported that even in 2009, many people in Gujarat, because that proper thing, the research that they conducted was in that state, and they saw that many of the people, they contracted the hepatitis because of the reuse of unsterilized syringes. So after this period, after like 2000, 2009, then people started getting more aware about the these medical practices that are being used. Should not make a mention, but sometimes, you know, like the poor people even in the rural areas, when the doctors say that, you know, medicines are enough for treating the disease, sometimes they will say that, you know, please give me an injection, doctor. You know, I know that I will get better only after getting an injection, because they feel that only injecting something into their body, only then they are going to get better, and that could, the doctor may even give them certain B complex or certain multivitamin or neurobion injections just to boost, you know, their immunity and certain other factors. So that is a level of awareness in India, and thereby it may be possible that in the rural areas there may be even the unprofessional healthcare workers who may and who can possibly reuse the unsterilized syringes, and they may not be using the one-time syringes. Here again the population will be at risk to these kind of diseases. But now this has come under control after the 2016 Act also. More and more people are now getting aware of these things, and the situation is really under control in our country. So the rules after 1998, it were modified, and there were draft regulations that came out in 2000, in 2003 and 2011, and the Ministry of Environment, Forest and Climate Change in March 2016 they amended the existing rules, and they have increased the coverage, simplified the categorization and authorization, while improving the segregation, transportation and disposal methods to decrease the environment pollution problems. Let us now see some salient features. We cannot cover everything, but let us see some salient features which are of importance, which have been covered in the biomedical waste rules of 2016. The scope and the rules has been expanded to include the various health camps such as vaccination camp, blood donation camp and also the surgical camps. The duties of the occupier of a healthcare facility that have been revised, and occupier means he is a person who has administrative control over the healthcare facility generating the waste. Then a pre-treatment, compulsorily pre-treatment of the lab, the blood waste, microbiological waste on the site is required before disposal of these waste. The method of sterilization or disinfection should also be in accordance with the National AIDS Control Organization. In short, it is referred to as NACO and the WHO. The use of chlorinated plastic bags, gloves, blood bags, etc. all this should be halted and it should be phased out. They had given a period of 2 years that they should be phased out. Then their training, proper training should be given to all the healthcare workers. Then they should be protected against diseases such as hepatitis B, tetanus, and proper immunization should be given to them. Liquid waste, they also have to be separated at the source by pre-treatment before mixing with the other liquid waste. Then they need to set up a barcode system for waste that is to be sent out for treatment and disposal. So there will be a barcode and that will be exemplary, that will be written that needs treatment and further disposal activities. Incinerators which were once existing, that should be upgraded and modified to achieve the new standards within 2 years from the date of that notification. That is what it is given in that act. Disposal register also is to be maintained every day and it should be updated on monthly on the website also. Then the duties of the operator of the common medical biofacility plant and the treatment and disposal facility, that have increased. So they have more work now. They should also assist in training in barcoding and global positioning system for handling of all the waste. Then they should maintain record for the operation of incineration, hydroclaving, autoclaving for a period of 5 years. All these records should be maintained properly. Then the segregation, packaging, transportation and storage of the biomedical waste, that is also now improvised. So waste has been categorized into 4 categories based on the color code type of the waste and treatment option. For example, the untreated human or animal anatomical waste, soiled waste, biotechnology waste, they should not be stored beyond 48 hours. And if it has to be stored due to certain reasons, then again the appropriate measures have to be taken so that the human health and the environment is not at risk. What are the benefits of these new biomedical waste rules? So it is that the new rules are more stringent, they are elaborate, and any rule or any waste rule which is amended, they are trying to bring a change in the society. And the biomedical waste is being managed in India, like how this has to be managed in a country, it is better. Under the new rule, the coverage has increased to include the various health camps also, including the vaccination camp, the blood donation camp and the surgical camp, because they are also kind of the mini biomedical centers who are generating such kind of waste. Then again, segregation, packaging, transport and storage of waste. Segregation has to be done at the source of generation of the waste. So at the source itself, if we can segregate, then nothing better than that. Color coding like yellow, red, white and blue, and you also have the black bags. These are all the bags and the containers that are linked to a particular type of waste and its treatment option. For example, if you have medicines, the pharmaceutical waste, that maybe have to put into a black container. Then the disposal of the chemical and the solid waste or cytotoxic waste, that may have to be done in a yellow bag, and then that goes for the further incineration, plasma pyrolysis or the deep burial. The segregation guidelines. So here you are seeing the color and the waste description. So yellow, that can include human tissues, organs, body parts, body fluid, cotton, dressing material and so on. Red, this can include the catheters, tubes, the cannulae, syringes, plastic intravenous bottles and sets, then used gloves and so on, vaccines, etc. Then the blue ones, they can contain the glass items, then the needles, the syringes, scalpels and the unused sharps, etc. Black will contain the discarded medicines, discarded cytotoxic drugs, etc. Green will contain the non-hazardous waste. So that is a general waste, non-infected plastic materials and paper, disposables and cardboards and containers, metal containers, office waste, food waste and so on. So all this have been recommended. The healthcare facilities have to do pre-treatment of all their waste according to the guidelines of the WHO and also the NACO in order to decrease the chances of the infection. So plastic bags, a glove, the blood bag, all this slowly they are trying to eliminate these in phases, so that the emission of the dioxins and furans also will not be coming once they are incinerated or burned in the environment. And then the waste in the proper bags for recycling also will be only sent to authorized recycler. It cannot be given to any rag picker. Then emphasis to recycling is also given in order to conserve the resources and to reduce the pollution load. Now let us see incinerator. This was the first solution and this has been used for so many ages and years. It is a first solution for the disposal is to burn the waste. Even human body also, the dead body, if you see, burning is also one kind of an option And nowadays we also have the, in order to protect the environment, we have the electric crematoriums and incinerators, where on the click of a button the body is burnt to ashes, and there is a separate place where the ash gets collected, and then that can be taken for the future religious activities or for the proper disposal in the scientific manner. Now, based on high temperature that kills pathogens and destroys the material in which the microbes reside, the temperature will be used. But number of toxins are released, that is a byproduct, that is a disadvantage, because it can, due to the incomplete combustion, everything cannot be incinerated. So, the furan, the dioxin, and then after or during the incineration, post combustion cooling also take place. So, some of the components, they can dissociate and they can recombine, they can form the new particles which can also be toxic. Dioxins and furans are toxic chemicals, and they are unintentional byproducts of the waste combustion. They can accumulate in the fatty tissues, and they can also magnify in the food chains. So, what are the other technologies for the safe biomedical waste disposal? There can be thermal processes. In this, you can use low heat, medium heat and high heat technologies. Low heat, that can operate between 93 and 177 degree centigrade. That can include the microwave, autoclave, and mainly in this sterilization occurs. So, hazardous waste, the chemicals cannot be autoclaved because they release toxic emissions. Heat resistant containers, beddings and other bulky waste also, they cannot be disinfected in the autoclave. Medium heat, that is between 177 to 540 degree centigrade. This includes reverse polymerization, thermal depolymerization. It involves the application of high energy microwave in nitrogen atmosphere to break down the organic matter. High heat, this operates between 540 and 8300 degree centigrade. This involves the processes of pyrolysis, oxidation, plasma pyrolysis, induction based pyrolysis, and in the pyrolysis oxidation, inside the chamber, the organic solid and liquid waste, they can vaporize at high temperature, that can leave behind inert ash, glass and also the metal fragment. This is again followed by combustion of the vapors at very high temperatures up to maybe 1000 degrees and so on in a chamber, and the clean exhaust steam is also released. Plasma pyrolysis uses plasma torch to generate the plasma energy, and in the plasma state the ionized gas can conduct electric current, but due to its high resistance the electric energy is converted to heat energy. The residue generated includes carbon black, vitrified glass aggregates and also the metallic residues. So, a variety of waste can be destroyed in the plasma based technologies: infectious waste, sharps, the plastics, dialysis waste, hazardous waste, chemotherapeutic waste, chemotherapy waste and the low level radioactive waste. Advantage of this are low emission rate, waste residue is inert and sterile, they are environment friendly, and there is reduction in the volume and the mass of the waste. Disadvantages include that they include high capital cost, there is high operational cost, high electric usage is there, limited lifespan of the plasma torch, and it can generate toxins in the poorly designed setups. Now we have the chemical based technologies also. In chemical you have the chlorine and the non-chlorine based systems. Chlorine based means they use sodium hypochlorite or the chlorine dioxide. Sodium hypochlorite is also used as a disinfectant for cleaning the surfaces. But in this also toxins such as dioxins, haloacetic acid and chlorinated aromatic compounds are released where the sodium hypochlorite is used. Again, chlorine dioxide is unstable, it is a strong biocide, it decomposes to form salt, less toxins are produced with it, and this does not react with ammonium or alcohol. The things that can be treated with the chemical based technologies of chlorine based technology, that includes the cultures, the sharp, liquid waste, human waste, laboratory waste and also soft waste. Volatile, semi-volatile organic compounds, mercury and radiological waste cannot be treated with this chemical based method. Then the chemical based technology requires closed system and it is operated under negative pressure, and the exhausted air has to be passed through the HEPA filter to protect against aerosol formation during the shredding processes. Non-chlorine based technology uses either gas, liquid or dry chemical. Alkaline hydrolysis at high temperature that can convert the human and the microbial waste into neutral aqueous solution. It is used for human tissue waste, body fluid and also the chemotherapy waste. Advantages: it is fully automated technique, it is easy to use, there is ease of discharge of liquid effluent into the sewage and no byproducts of the combustion are formed here. Disadvantages: toxic byproducts due to large scale chlorine and hypochlorite use, chemical hazards and offensive odors can be released. Finally, ionizing radiation or IR. This can cause damage to the DNA, it can produce free radicals, damage the proteins and enzymes of the infectious particles. So, this is also used as an alternate technology. The electron beam technology produces the ionizing radiation as a beam of high energy electron propelled at high speed to hit the target or to speed the target. The infectious waste, human lab waste and soft waste that includes gauze, bandages and gowns and sharps can all be treated using the ionizing radiation. Advantages: it does not produce toxic emission, it is liquid effluent, no ionizing radiation after the machine is switched off, and it is a low operational cost equipment. Disadvantages: radiation exposure can be there, so the technicians and the personnel who are operating should be well trained. Concrete shield is required that should be several feet thick around the system so that the radiation is not exposed. Removal of the ozone gas, the shredders and grinders, all this are required in order to reduce the waste volumes. The biological method or the bioconverters. This uses a solution of enzyme to decontaminate the medical waste and resulting sludge. Water is removed for the sewage disposal and the solid waste will be sent to the landfills for the further treatment. Another method is also using biodegradable plastics. So, many biomedical plant they build their processes with the biodegradable plastic, and this plastic can undergo biological degradation with the microbial extracellular enzymes. So, the microbes are using the biodegradable polymers or those bags as substrate for their metabolism. So, dear learners and viewers of this module, I hope you have had a good understanding of how we can treat the hazardous biomedical waste using the chemical methods, a simple biological method, using incineration methods, using the thermal technologies where low, medium and high heat technologies can be given, and also using certain ionizing radiations and methods where the waste can be tackled properly. We also saw the latest biomedical management rules which came out in 2016, and this is more effective and it focuses on minimizing the waste also which is generated at source, and it requires more rigorous and proper training also to the technical workers and those who are involved in the segregation of the waste at source itself from the hazardous and into the hazardous and the non-hazardous waste. Thank you for your patient listening.